My name is Dr. Prasanta Kumar Nayak. I am the clinical head of Oasis Fertility Hospital, Bhubaneswar branch. So today we'll discuss about how to manage infertility in cases of PCOS patients. Polycystic ovarian syndrome, which is a multi-system disorder. Rather, it is not a disease; it's a syndrome which involves multiple means organ and you can say the endocrine systems of the body, where usually the females do have irregular menstrual cycles, which leads to anovulation or irregular ovulation or oligoovulation conditions, where the female is unable to ovulate regularly, cyclically every month. That leads to infertility or delayed fertility. At the same time, there occurs a lot of imbalances in their endocrinological or hormonal system of their body. Like there is increase in the androgen level in the body, where the androgen level of the female is increased, leading to features of hyperandrogenism. Like they have excessive hair growth in their facial area. There is hair loss from the frontal baldness occurs, and as well as there can be hoarseness in the voice, and there is excessive acne development. So these are features of androgen excess in the body. At the same time, there can be insulin resistance, which usually leads to increased blood sugar in their body. In the long run, all these metabolic derangements may also cause some systemic disorders like high blood pressure and some hypercholesterolemia or lipid dyslipidemia, or increase in the cholesterol level in the blood circulation. In the long run, such people may suffer from various heart diseases and so also cancer. Well, that is the long-term issues. But at present, if we'll come to our fertility practice, we do come across around 30 to 40% of the infertility patients are suffering from polycystic ovarian syndrome, because as I told that this syndrome is due to anovulation or oligoovulation, where the regular natural ovulation is not occurring. That's why even if the couple are staying together and having regular intercourse, still they are unable to achieve their pregnancy. So in such situations, the first thing we try to address is we try to confirm the diagnosis by doing an ultrasound, where we do find if the number of follicles in one ovary or both ovaries is more than 20, or the volume of the ovary is more than 10 cc, along with they have irregular cycles or features of hyperandrogenemia, then either two features is present, then we diagnose them polycystic ovarian syndrome. After diagnosing, then we try to find that if there is any other cause of infertility, like we evaluate the male partner and explore that male partner is normal, or if there is any abnormality so far as his semen parameters and other functions are concerned. If that is normal, then we concentrate on the female partner. We do also at the same time try to evaluate the tubal function test, like we see whether the tubes are patent or not. For that, either we go for a hysterosalpingography, HSG test, or saline sonohysterosalpingography, like SIS test, or also we go for a diagnostic laparoscopy with chromoperturbation test. Either ways, we try to find out that their tubes are patent and her husband or male partner is normal, or if at all he gets any treatment. But at the same time, if we find that this particular female is suffering from polycystic ovarian syndrome, then definitely that may be the primary cause of infertility. So to treat that, we start with that we try to find if whether there is any other issues along with PCOS, like she is having diabetes or increased insulin level in her blood circulation, whether there is any other comorbidities like hypothyroidism, which is usually found in association with the PCOS, or there is features of hyperandrogenism. So along with that, the basic treatment protocol of polycystic ovarian syndrome, after a basic evaluation, history taking, and proper examination of the patient, is that we try to give them some advices related to their lifestyle. That is the first line of management of PCOS. Then we come to pharmacotherapy and any advanced treatment if at all required. The first and key treatment modality, that is the lifestyle management, includes strict dieting and regular exercise. So strict dieting means she has to take a proper balanced diet, which should be less in carbohydrate content, more in protein and protein content. And at the same time, she can cut down her fat content also. So if someone is consuming less amount of calories in the form of carbohydrates, more of raw phase or fiber-based food and protein, definitely her body weight will start reducing. At the same time, we also give emphasis that she should have regular exercises in the form of mild to moderate intense exercises or intense exercises. If this is on she is in the habit of doing moderate intense exercises, then she should have at least 250 to 300 minutes of exercise in a week, which amounts to around 40 to 50 minutes of moderate intense exercise per day for at least 5 days in a week. If she wishes to have intense exercise, just like weight bearing, gym exercises and all, then she could undergo at least 150 minutes of exercise in a week. That means around 30 minutes of exercise for 5 days in a week, or she can even have it for 7 days. And because these exercises usually improves in the losing the it leads to weight loss. At the same time, it causes good blood circulation. Her hormone level starts getting balanced. So regular exercise in the form of gym or jogging, or you can say skipping or doing some kind of sports, dance, any physical activities which will cause sweating and active muscle and exercise of the in the system. So this is the key point, along with diet. At the same time, we give importance that we try to find out their surrounding, their profession, their work pattern. So because always we try to tell them that you should reduce the stress factor in your life, you should take adequate rest in the night in the form of 8 to 10 hours of sleep in a day. At the same time, you can do yoga or any other pranayam and any other form of techniques where you can have stress can be lessened in your life. So those stress reducing methods or some advices also we give. So all these things helps them in maintaining a good lifestyle. So lifestyle management is the first and most important role in the management of PCOS, even if it is for infertility. After that, we come to address that how we can improve their ovulation, because as I told that in PCOS patients there occurs ovulation disorders. So for that, usually after assessing the male factor and her tubal function test, if we find everything is fine, then we go for ovulation induction. Usually ovulation induction is given in the form of medications, tablets. So letrozole, clomiphene, metformin. There are so many kinds of tablets or oral medications which are usually given from the early start of the menstrual cycle, and these are given for a particular days of duration. Then we usually monitor their increase in the size of their ovarian follicles. So when the follicle size is increasing in a regular and appropriate manner, then we wait till the ovulation. Or if it is in a very slow growth, then in that case we also use some injections like gonadotropin injectables, which helps in increasing the size of the follicles further. So once with the follicular monitoring in the ultrasound, we find that these follicles are of adequate size or dominant, then we go for some trigger, or you wait for a spontaneous rupture of the follicles. And that is the time usually we ask the patients to have timed intercourse, or else if they wish they can go for also intrauterine insemination, where usually we take the husband's semen and we process it, and the motile and the good morphology sperms are being separated from the entire sample of the semen, and around zero point 0.3 to zero point 0.5 ml of the processed semen is being means injected or means being introduced into the uterine cavity of the female around the time of ovulation. So this is how it is done to achieve the pregnancy. Usually, if you'll see what is the pregnancy rate, either you are going for a ovulation induction or IUI. So this can be in ovulation induction, you may have around 5 to 10% of pregnancy rate, and if it is a case of IUI, you can go to 15 to 20% of pregnancy rate. So many patients get pregnancy in this way, with combined with lifestyle management along with ovulation induction or IUI. But still, we find that there are many patients who are still not achieving the pregnancy, because as such in polycystic ovarian syndrome patients, even if there is ovulation, the chance of getting pregnancy is lesser if we compare to their normal counterpart, because it has been seen that the quality of the eggs that is being released in PCOS patients is not that good, or it not that strong as that of the normal counterparts. So overall, their pregnancy rate, even if after these treatments, is lesser. So if they are not conceiving even after 4 to 6 cycles of IUI or many cycles of ovulation induction, then usually we advise them to undergo IVF, in vitro fertilization or ICSI. So in this method, usually the patients are evaluated thoroughly, and they give the proper counseling that what is the need of the IVF, why they should go for IVF, whether they are actually prepared for it, not whether their indications are not, whether they're financially prepared or not. After that, if it is found to be suitable, then only we go for a IVF or ICSI treatment plan. In such treatment, usually we give them injectables for 10 to 12 days. It starts from the second day or third day of their cycle, and they are regularly monitored with their hormone levels, and the follicles are monitored in the ultrasound. And the doses of the gonadotropins or injectables are monitored day by day. So all these things leads to development of multiple follicles. Usually after 10 or 11 days of injections, they become dominant follicles. Then we plan for a ovum pickup. Usually it is done under anesthesia, and through vaginal ultrasound guided, we usually aspirate their follicles, and the eggs are retrieved, and it is being under examined by the embryologist to separate the eggs from the follicular fluid. And after getting the eggs, usually in polycystic ovarian syndrome, we get number of eggs retrieved are more than that of their normal counterpart. And after getting the eggs, usually the husband's semen is taken and processed, and from that, usually the sperm part is being picked up and ICSI is performed or IVF is performed. So this fertilization process is being conducted on the same day. Then these fertilized or these eggs are subjected to become embryos, for which they are being kept in the culture medium in the incubator. So they are we wait and observe the growth of these fertilized eggs up to 5 days, and after the end of the 5 days, we see how many of them are converted into embryos. So when we get day 5 embryos, then we find what is the grades of the embryos, and if they are of suitable grades, then we use to freeze them. Because in polycystic ovarian syndrome, so it always convince, or we always advise the patient not to undergo any fresh transfer. So all these embryos are being frozen, cryopreserved. Then after 1 month, and after there being initial assessment and hormonal measurement of their blood, usually we plan for a embryo transfer. So usually embryo transfer can be performed at least after 1 month gap when their body hormone levels come down. Otherwise, there chance that there is development of ovarian hyperstimulation syndrome, which is a complication usually we come across in PCOS patients. Either they are having fresh transfer, even if there is no fresh transfer. So to reduce this OHSS complications, we do some prophylactic treatments, and we do follow the protocols like antagonist protocol, where the chance of ovarian hyperstimulation syndrome is less. So all these precautions are taken to tackle the complications in case of IVF treatment for PCOS patients. At the same time, as I told that even if we are going for a treatment like IVF in case of polycystic ovarian syndrome, always we keep in mind the complications involved and the rates of success involved. Because even if there are a good number of eggs, as the quality of the eggs are compromised, so finally we have amount of good quality embryos. So from beginning, we counsel the patient for all these possibilities, and also the success and outcome things are being properly explained to the patients. But yes, as a part of preparation ovulation induction or IUI or IVF, always we give importance on lifestyle management, diet, exercise, and weight loss if they're obese. And along with that, we also preparation for them, so that their outcome or the treatment for infertility will be good. So ultimately, they will get their benefit. So friends, as I've already told that, yes, polycystic ovarian syndrome is a condition which is associated with infertility because of ovulation disorders. So along with that, that definitely we should address the associated factors and the factors which will lead to the success. So the key treatment modalities I have already described. So if we'll come to ovulation induction or IUI, these are some of the basic treatment protocols which involves less cost, but success rate, it has limits also. As I already described, it is lesser than that of the normal counterparts, but many patients do success with this. But sometimes also some patients are advised for laparoscopic surgeries like drilling and all, but it is not a first line treatment. Definitely it should not be overused or misused. It is always a second line or third line treatment. Rather, those patients who are not responding to ovulation induction by clomiphene citrate, or those are not even they can be used with gonadotropins. Even if they are not responding to gonadotropins, that is the area where it comes the role of ovarian drilling, because looking at its complications, looking at the surgical interventions and the anesthesia complications, so we should not take it as the first line. Even second line is not good. So these are the various treatment modalities for infertility management in case of PCOS patients. So this is in brief and in a manner of giving salient points and how we should approach patients with polycystic ovarian syndrome suffering from infertility. I just given the overview. So if you have any doubts, if you have any questions to ask, you can ask me so that we can discuss further. Thank you. So someone is asking that my wife has undergone two IUI cycle, both have failed. What is the cause? Yeah, as I already told that IUI intrauterine insemination has a success rate of around 10 to 15% or 15 to 20% maximum. But in case of syndrome, in case of polycystic ovarian syndrome, this success rate is still less. It can be because of the quality of the eggs are compromised because of its inherent quality or whatever inherent properties. And that's why even if undergoing two IUI cycles, I don't think it is adequate to tell that yes, she will not have success in future. So she should try another few cycles of IUI also. She can, if you have enough patience. And if your doctor advises to wait, you can go for another one or two or three cycles of IUI. Else, if it is if your ovarian reserve has started falling and you don't want to wait further, then you can go to the next modality of treatment. But yes, why it is failing means if you just assess whether there is HSG test or tubal function test is already completed or not. Every time you also find whether there was ovulation before or after the IVF procedures, that you should ensure. Many times there are cause there the ovulation is also not happening, that so that the IVA, it means the pregnancy will not happen. So you should keep in mind and you should find out the data whether it is going on in a right track or not. Thank you. Are there specific diets or supplements that you recommend for PCOS patients trying to conceive? Well, so specific diet or supplement is not there, but I must suggest that as it is also recommended that you can use whatever you eat at your home, but you remember that the diet composition should be different. The total amount of carbohydrate in the form of rice-based or atta-based food should be reduced. Rather, you should replace more of raw foods, means you can say the salad items, dietary fibers, and you should also include more of protein in your diet. And that should be and you can consume any kind of food whatever you are eating, but your composition should be of less carbohydrate and more of protein and fiber based food. Along with that, you should also give emphasis on exercise. Routine exercise, daily exercise should be encouraged. Yeah. If there is any other question. Well, if there is no more question, then we can conclude our session here. So if you have any queries further, you can connect to our Oasis Fertility helpline number. We are always there to help you. And thank you and have a good day.